Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In this video I'm going to be looking at why diagnosis is so important for dissociative conditions or disorders, and why an accurate diagnosis is especially important, and that's based on the quality of the assessment and the nature of the background material, the presentation, all the various different factors. And that's a thing in itself, really, sort of how to do an assessment of any mental health condition. But in this video we're going to look at much more around why the diagnosis is so important in the first place. There is a lot of controversy about diagnosis in mental health, and there is various different views and perspectives on this. Some people think that diagnosis pathologizes people's sort of normal functioning or everyday functioning, or that sort of traumatic conditions get pathologized into mental health disorders, or it's about blaming and all sorts of various different things. So there's a lot of literature out there on why diagnosis is relevant and why it's sort of subject to such controversial views out there in the world. All of that is fair enough, and again, various different things and different opinions and impressions on that can last. Here in the clinic and amongst our sort of colleagues and within the network of clinicians working with dissociation, we generally believe that an accurate diagnosis is a necessary component for any starting point for treatment in dissociation. So that's really the first point, is that it's so necessary for the way that we approach treatment, and the protocols and the guidelines that we use is to really understand exactly what it is that we're working with. Now, a lot of diagnoses can take place quite naturally through the therapeutic process. So a person can come into therapy for all sorts of different conditions, let's say post-traumatic stress, and it becomes understood in time that actually that person is dissociating quite heavily, and the nature of the dissociation becomes apparent during the therapeutic process. That can take place over weeks and months and lead to a diagnosis, and that's absolutely fair enough. It's based on good evidence, clinical evidence available to the therapist. Provided that they're trained and competent to make a diagnosis, they can do so. Often what happens is we get contacted, for example, by such therapists to assist in the diagnostic process because they haven't been trained in diagnosing, but they're clear that there's dissociation taking place, and we assist with that wherever we can. But many people with dissociative disorders really go undiagnosed, in that it's not seen. One of the difficulties here is what's called co-morbidity, which is that many people get diagnosed with other conditions, and the dissociative elements of whatever they're experiencing get unnoticed. They don't get seen. So, for example, personality disorders or trauma-based disorders, eating disorders, neurological disorders. There's a whole raft of these different things, and dissociation is often present with those people, but people aren't, the therapists, the clinicians are not looking for it, they're not seeing it, and therefore none of it's being diagnosed. And one of the difficulties here, and this is one of the key elements to answer the question about why diagnosis is important, if you don't diagnose, you don't often know what you're dealing with, therefore you're not treating it properly, and therefore the likelihood of a successful recovery from dissociation is reduced. So if you don't know that dissociation is present, you don't know what kind of dissociation is present, you're less likely to actually gain a significant level of recovery from that, because no one's going to be treating it properly. So one of the key bits here is that the diagnosis informs the treatment pathway. It gives the therapist clear indications about what it is that they're supposed to be doing when they're going about the treatment. And another thing that's particularly complicated is the way that people can self-diagnose. And this isn't just about dissociation, this is everything. I mean, Dr. Google has been one of those things that's been around for years and years and years, that people experience a couple of symptoms, they go online, they check up a load of stuff, and they think that they've got what they've got. Sometimes they're right, sometimes they're not. So we have what's called false positive and false negative situations. The false positive is where you diagnose something that isn't there, and the false negative is that you miss the diagnosis. You say it's not there when actually it is. So the training about diagnosis, the clinical competency around how to make a diagnosis, has to factor all of these things in. It's got to take into account as much information as possible so that we get to the accuracy. And self-diagnosis is often something that people start with that leads them to a formal diagnosis. So it's quite handy in that respect. It can be difficult, and people can actually just wander through life believing they've got a condition they don't have, regardless of whatever it is, whether it's physical or mental health type stuff. And that can be really quite distressing for people, because they never truly know. So we always say, if you think you've got something, go and see the best as you can, get it checked out by a professional in that field. Which brings us to one of the other points about why it's important is there are so many different types of diagnosis that it could be. So we have to make sure that we rule other things out. Certainly for a lot of dissociative conditions often have a physical element. This is the somatizing effect, that many of the dissociation sort of symptoms work themselves out physically through the body. So we can jump to a conclusion and say that all of those symptoms are therefore dissociative, but we have to take the medical, the physical, the organic into account. So if we believe that there is a potential physical thing going on with dissociation, part of the assessment and diagnosis is about ruling out other conditions that it might actually be. So example, for neurology, a person might be experiencing kind of some sort of like seizure type attacks or episodes. We have to make sure that that actually isn't epilepsy. So we guide to neurology, we rule out the sort of epilepsy as a diagnosis. That brings us then back to the dissociation and looks more about sort of like some sort of functional neurological states that it might be. So being able to take all of these factors into account is really relevant, it's important, and it can take quite a lot of time. So another point about why the diagnosis is so relevant and so important is that it's a time-consuming process. You build a huge amount of information about the person, about the nature of their dissociation, about the system in which that dissociation is playing itself out, and that information is all guiding us towards accurate treatment and recovery from the dissociation. And what that recovery looks like is entirely unique and individual to every single person that we would work with. But having that information available, knowing which bits of dissociation are more relevant, which bits are less relevant, out of all of the different types of dissociation, there are many different diagnoses that can be used within the dissociative spectrum, and whether you're using one guidance book, say like the International Classification of Diseases or the Diagnostic Statistical Manual, there's a whole different raft. I'm going to put on the picture, the screen here, some of the different diagnoses that are available between the DSM and the ICD, just to give you an idea about how difficult it is to establish the correct one. And it is really important to be able to do this because it helps the person understand what their symptoms are, which can immediately reduce some degree of distress as much as possible. It allows for good quality information to be given about how to look after different things, about what work might be needed to do around the scenes in between therapy sessions. And as a signposting towards therapy, for a lot of people, that's about an insurance-based arrangement to get into therapy. Within the UK, it's about getting into NHS pathways, and that diagnosis is often the key to open the door for treatment to take place. So all of these things basically mean that this takes quite a bit of time. There's a systematic approach to doing it, and we're trained and we offer training in the semi-structured clinical interview, the SCID-D for dissociative disorders, that's been written by Marlene Steinberg. So we provide training on this throughout the UK. We're about to embark on some international training for this, and I'll put some details on another video a bit later on, so that we can really try and guide as many therapists as possible with competency in diagnosis towards getting an accurate diagnosis, either through the kind of structured assessments that we do or throughout the course of a therapeutic relationship to build the evidence to work towards the diagnosis. And that evidence and that structured interpretation of the evidence is vital because a lot of people dismiss a dissociative disorder. They don't believe that that's correct. They don't believe that it's really a thing, or that they don't really understand what it is, and having a report that clearly sets out all of the evidence for the diagnosis, that gives what we call an audit trail towards why we would arrive at that diagnosis. It allows that individual with that dissociative disorder to really have some sort of reliable information about the nature of their diagnosis, which often kind of changes the course of a recovery process. So with all of these different factors, getting the right information, doing it in a structured way, providing the evidence for it, ruling out other conditions or assessing for additional comorbid conditions that may also be present, factoring in all of the different elements of that, guides that person towards a treatment pathway or a protocol. It can open the door for funding depending on what country you're in and what your health system looks like. It can provide accurate and reliable, correct information, and it can help people have peace of mind that what they're doing is not about being crazy. there is a different name for it and there is something that can be done, because the beauty of this is that dissociative disorders are entirely treatable. And again, what that looks like is individual for every different person, but the distress and the dysfunction and the disability that arises from severe dissociation is very, very treatable. We've demonstrated this in the clinic, and there are worldwide outcomes being taken place to demonstrate that treatment protocols are really, really useful and effective when done properly. So I hope this video has been of use. It's not a video on how to diagnose, because that's a 2-day training course that we put in, and that's a really, really complex thing to do, and it should be, because to diagnose a mental health condition takes a great degree of competency and professionalism. But this just really gives a bit of background as to why it's so important and why we approach it in the way that we do, so carefully and so in such a structured way, because accuracy is vital for this stuff. So I hope that's been useful for the therapists and people with dissociation I look forward to receiving the comments in the section after the video has been published, and in between now and the next video, please do take great care.